Tonight on Newsnight, we discuss matters health. We are all aware of the Ebola scourge that has ravaged West Africa, with over 1,000 people dead. Now, the latest and the only connection we probably have at the moment here in East Africa is one that Kenya Airways, which flies to West Africa and is normally the regional connection to West Africa, has halted its flights and halted the flights during this week. But also we know that Kenya and Uganda have in the last few days continued to test those who have been coming in with some suspected cases, but all have been discovered negative. Tonight we discuss the implications and of course what's exactly happening in West Africa. That and much more on Newsnight. The old man of the clan, Andrew Mwenda, CEO of The Independent.
Had you forgotten my name?
Let's discuss this. The fact that people would really normally ask me, does Andrew have to know everything about everything?
Yes,
or something about everything?
If you are 100
years, first.
If you are 101 years like me, I turned 102 on 3rd October. Really, it is a long time when you know many things. Now, let me give you statistics on this issue.
Yes.
Uganda is the one country that has been hit most by Ebola.
Yes, in the past.
The first time Ebola hit this country, listen carefully, was in 2000. Number of infections, 540. Number of deaths, about 249. Right? That's about 50%.
Yes.
Less than 50%. The second time it hit us was 2007. The first was in Bundubujo. One of the reasons why there were high infections and high deaths is the government did not have control over most of the countryside. And there was a war with Konyi, which increased the death toll. But the second time it hit us in 2007, it was in Bundubujo.
Yes.
So there was no war there. Number of infections, 98. Number of deaths, 37. Third time it hit us was 2012. This is recent, 2012.
2 years ago.
In July.
Yes.
When it hit us, only 15 people died. It hit us again in November. Only 3 people died. Not once did Ebola exceed the boundaries of Uganda. This Ebola you hear, and each time it has hit Uganda, it has been contained and resolved, let me say, within about 2 months.
With some suspect cases coming into the city. I think we had one or two cases in the city.
But here is the situation.
Yes.
This Ebola started in Guinea.
Yes.
In December. It spread to Sierra Leone, Liberia, Nigeria. Now areas are being declared no-go zones. It has now, people have been taken to the US and Spain. It has lasted months. Many people are dying. And I just cannot understand. I used to be so critical of the Ugandan healthcare system and the ability of the healthcare system to respond to disease.
To emergencies.
But
and epidemics.
Now this experience in West Africa has taught me that perhaps we Ugandans may be blind to some of the assets that we have. And those assets, of course, is a much more robust Ministry of Health able to effectively and efficiently respond to a health crisis. Really, that is a great plus. And that's what teaches me. Two, if you look at international coverage, they don't, you see, people in the Western world are the ones trying to save West Africa. Yet the people with expertise for quick and effective and efficient response are Ugandans.
Yes.
So I would be expecting that the Ugandan Ministry of Health officials are being talked to and being taken to West Africa to help those people contain this epidemic.
But there's been research done, and people have actually said that the virus is actually a bit different from the virus that hit us, the Ebola virus. That there is a strain. The strain is a bit different, and the reason of the mass deaths and
is the strain?
Yes, the change.
Actually, let me explain to you.
Probably the strain.
Let me explain to you. There are 2 strains that have hit Uganda. There is a strain that is based in South Sudan.
Yes.
There is a second strain that is based in Congo. The one of Congo is the worst strain, the most dangerous strain in the history of Ebola.
Yes. So
it's not the one in West Africa.
Yes.
When it hit Bundubujo, only 37 people died in 2007. And 2, the problem is not the strain that you see in West Africa. It is a problem of you see, a health system has the following system. It has hardware, which is you have laboratories with equipment, you have hospitals, which are buildings.
Yes.
But then there's something we call a system. A system is a social software that allows people to respond to a health problem with the organization and intellect and thought. Now that is what contains the disease. It is not the quality of the strain of the Ebola. What we see in Uganda is immediately they hear of Ebola, the minister sets up a committee, the response is quick, fast and decisive. What happened in West Africa, perhaps also you could say that Uganda has had experience of 4 times, so we have accumulated institutional memory, we have experience and knowledge on how to handle this disease. But even the first time, why didn't it spread from Gulu to Kenya to everywhere? It again shows that you have a much more robust Ministry of Health. Really, I'm so impressed. You see, the best way to analyze a situation is to compare. So when you compare with West Africa, you see that Ugandans should celebrate that they have a much more
robust system.
We may have problems at Malaga and many hospitals, but our healthcare system must really have certain qualities that allow an effective response to Ebola.
All right.
4 times.
Let's quickly discuss the economic impact of this, because you know KQ has cancelled its flights. Just before KQ cancelled its flights, Korean Air, which was flying into Nairobi, the only area it flies into in this region, had actually stopped flying into Nairobi. And we have European and American companies thinking about why they should continue flying into Kenya, because it's suspected they will, of course, have some people fly through Nairobi to either Europe or even America. How would you describe the impact that we will face, or even West Africa, which is hardest hit, will face from this Ebola scourge? Because there must be people who can't travel to West Africa now, and there must be organizations that have cancelled business with those countries in the time being as this scourge is being contained.
Well, I think that the biggest threat is going to be those countries of West Africa. If there were any tourists traveling there, I can tell you right now, only a masochist with an insatiable desire for self-destruction would certainly fly into Sierra Leone and Liberia. There are many stories you can read online of how people have, in Liberia, people went to an Ebola sanctuary, found Ebola people dying on mattresses.
And threw them out.
Threw them off the mattresses and stole those mattresses. So they were stealing death. You can see that ignorance. You think it can happen here in Uganda? Now, let me tell you this. Of course, Kenya Airways had initially refused to stop these flights. But realizing that if Kenya Airways keeps going there, one, it's going to discourage many people from flying the airline. It's going to discourage more. News will continue coming that East Africa is going to be at risk. Tourists will stop going to Kenya. Remember that Kenya is the largest tourist destination in this region. They receive perhaps about 10 million visitors a year. Uganda here we receive about 1.6 million. So we are just peanuts. So the bottom line is this, that I think the Kenyan Airways people have taken the right decision. If they're no longer flying to West Africa, and therefore they are outside of the danger zone, then it will not harm the tourism industry in Kenya. The decision has been the right one.
All right. Thank you very much, Andrew and Zores. And that was Newsnight for this week.